party like LCC's never done before. It's called Jingle Jam, and we want you to come. For kids K through 5th grade, bring your whole family to experience Christmas with all your senses. Look, taste, touch, and hear the Christmas story. It's going to be a great time for the whole family to experience. You can get all the details and sign up on Facebook. Find Liverpool Family or at liverpoolfamily.com. We'll see you then.
This is our final week in our series called Mirror, Mirror, and what we've been doing through this series is going through a couple things about mental illness and discussing some of the issues with mental illness, some of the stuff that maybe you've never heard talked about in a church before. Anxiety and depression. I know that a lot of times churches would kind of allude to something like that, like, oh, we've all got problems. But that's not really our style here, to just kind of touch the surface of something. And so today I'm really excited to close our series on mental illness by having a actual professional here. I know I've been parading as a professional. I'm not, by the way, a professional. I need professionals. And so my desire through this series, though, is not that we would quote-unquote fix anybody, but that at the very least we would get conversations started about mental health issues and mental illness, and that way we can take these things head on rather than pretend like they don't exist or not deal with them. So I want to introduce you to our special guest who's going to help shine some more light onto mental illness. She graduated in 2012 from the University of Rochester with a master's in marriage and family therapy. She served 4 years as a family therapist for children placed with their grandparents. It's a very specific time. And she was an in-home therapist for youth and families where children were at risk of placement. And what that means, if you don't know, it means that they're going to be taken out of their home and placed somewhere else. So she worked with them since 2016. She has been working privately out of the Family Center in Baldwinsville, seeing individuals of all ages, couples, and families. She is a Christian. She is a wife. She is a mother of 2, and she is a therapist. She is also a children's ministry volunteer here at Liverpool Christian Church. Please welcome Melissa Raab. These stools are too short for this table. I feel like I'm my kid at an adult table right now.
It's like perfect height for me. This is great.
So Melissa, why did you decide to go into this field?
I grew up knowing that I wanted to help people, and from about 7th grade on, I kind of was that person for people who people kind of came to and gave their story to and talked through things with. So it just kind of seemed like a natural fit, and so things led me to therapy.
Nice, thank you. So you're a Christian, and one of the things that she told me early on in this is she's not a Christian therapist. She's a Christian who happens to be a therapist, and I like that. And so I was wondering how, for you personally, how does your faith in Jesus affect your job and what you do? By the way, I just want to say it's funny because she already had all these questions ahead of time, but I'm going to present them as though it's the first time she's heard them.
Yeah, it doesn't make sense.
So what do you think? Here's a shocking question.
So my faith definitely plays a role in therapy. I'm not preaching to people or anything like that, but it allows me to deal with difficult situations with more grace and love and compassion. There are times when there's an incredibly difficult session that afterwards I am praying for that person. So it definitely influences what I do.
I think that's amazing that there is a therapist who is affected and takes that person's thing to Jesus, on behalf of them. So I appreciate that about you, and I'm thankful that you're here. Thanks for helping us with this today. So some of these questions, we're going to kind of go through them. Some of them will be on the screen. Some of them will just be kind of ad-lib because you know how I am. So let's talk about this. What is a mental illness, and what does it mean to have a mental illness?
So a mental illness is a condition. It affects a person's thinking, feeling, or mood. It can affect how somebody is able to relate to somebody else. It can affect just daily functioning. There are many different causes of mental illness. It's not just one thing that can cause it. I think a lot of people get this idea that it's just difficult life circumstances and that's how you're coping, but there's actually biological factors, there's genetics, there's trauma, high stress, all sorts of things kind of pave the way for mental illness to
Right, and
develop.
so, and then there's also levels of mental illness. You know, I got a little bit of this, or I got a lot of this kind of thing.
Right, yeah, and there's definitely severity. So when you're diagnosing, not to get too clinical, but there's severities of mental illness as well. So you can have a mild form of depression, severe form of depression, and everything between.
You get clinical as you want.
Okay.
We like it. So some people might confuse mental illness with mental retardation due to societal concepts or just not understanding that. What are some of the actual differences between that?
So they're just two completely different beasts. So mental illness is really a thought, feeling, mood disorder kind of thing. Mental retardation, it's now known as intellectual disability, but that's been changed in very recent years, so it's not really as widely known as mental retardation. It's more about below average IQ, below average daily skill level, and things like that, which is predominantly genetic, whereas mental illness has some genetic component, but it's also many other things.
Is it also, and I don't want to show too much of my ignorance here, but mental illness versus mental retardation, there's something that you can do about mental illness and not the other. Is that accurate or inaccurate or what?
Yeah, I mean, there's a cure. There can be cures for mental illness. There's ways to support people with intellectual disability and ways to enhance their ability to function on a daily basis and give them more skills, but there's no real cure.
Right, okay, all right. So in the series we talked specifically about anxiety and depression because we only had we had 3 weeks for this series. And so I wanted to kind of ask you why is anxiety and depression specifically, why are they considered mental illnesses?
So anxiety and depression are, in that definition of what a mental illness is, very much in line. Anxiety affects the way you're thinking and feeling. Depression is a disorder of your mood. Both of them can interfere with your functioning. Both of them can interfere with your ability to relate to other people. So those are, right in line with what a mental illness is. Both of them have genetic predispositions and things that can be going on with your brain, which is also part of mental illness too. So.
And they really, really screw up your daily activities.
Sure.
Or when you're struggling with them, they really kind of stop you and block you from doing the things that you want to do. Yes. And need to do at the same time. Whose fault is it that somebody has anxiety or depression?
Nobody's. So,
we have to have a scapegoat somewhere. We have to be able to blame somebody. So.
Right. Well, and it would be convenient if we could say, well, this one thing, if this one person caused me to have it, or my parents, whatever. There's so many factors that go into the development of anxiety, depression, any other mental illness, that two people can even experience the same exact stressor, and one may go on to develop a mental illness and one may not. It's just too hard to tell what exactly is a cause of it, so there's really no...
Yeah, you could go, like, I read a story one time about two brothers who had an alcoholic father, and one of them became an alcoholic because that's what he saw his dad do, and one of them never drank because that's what he saw his dad do. And so you're saying that just for anybody suffering with this, there's any number of events or multiple events that bring these things about?
Absolutely.
Yeah, okay. I like the next question a lot. I like it a lot. So it says, aren't we just playing into people's problems by giving them a name and talking about them all the time? Everyone struggles. Why can't we just accept that, grow up, and handle ourselves? That's about the most American question we're going to ask.
So I have a few thoughts about this. Kind of talking about giving names. The name or the diagnosis isn't everything. It's not the be-all, end-all. It's important, It helps to, on a research side, to be able to say, okay, this is the kind of treatment that is effective for these disorders. On a clinical side, I can say, okay, this person has an anxiety disorder, so therefore I know these strategies are most helpful. That's what I'm going to implement first. So those things are actually important. It's not just giving a name for the sake of giving a name. The second thing is that we absolutely do all struggle, and there are people who even I see in my office who don't have full-blown mental illness. People have what I would call an adjustment disorder. So there's a certain life stressor that is causing them a significant amount of stress. They may have some symptoms that look like depression, some symptoms that look like anxiety, but they don't meet full-blown criteria, and it's based on what is currently going on for them. These people are still in need of support. It's still a very big struggle for them. It doesn't mean that, it should be written off because it's not a mental illness. It's still important to kind of be with them in that. And finally, personally, I'm a Christian who is a therapist. I think the most Christ-like thing I can do, either as a friend or as a professional, is to be with somebody in a loving way through the most difficult things in their lives. That's just, so the idea of, just grow up and handle it, it to me is kind of the opposite of what I think of when I think of being Christ-like.
Yeah, I was thinking for that question, the old-timey movies like Clark Gable and those guys when some woman was acting hysterical.
Mm-hmm.
What did you do? What did the actor do to the one? Slap her in the face. Snap out of it, dummy.
Right.
Like, what's your deal? And I think that question kind of comes from that mentality and that mindset that there is a way to just snap out of something and get over something. And there might be, but it's not like a snap. It's more like like it takes time and therapy and work and things like that. So I wanted to get into some depression questions specifically because depression seems to be a very huge thing here in our area. If you don't know that, Melissa has office hours and you can visit her. So specifically about depression, what is it? Where does depression typically originate? Where does it come from?
So depression is a mood disorder. It affects how people feel, how they think, how they handle daily life activities. So it affects their ability to eat, it affects their ability to sleep, it affects their ability to function in work settings or school settings. So just like any other mental illness, there's a mix of things that depression can be caused by. So depression does have a genetic component, depression does have some kind of biochemical, our neurotransmitters, serotonin, those kinds of things that you hear about. There is that component that can be contributing to depression.
Chemical stuff off, chemical imbalances.
Right, exactly. And it can do with brain structure, it can do with stress, trauma, those kinds of things as well.
By that you mean events that happen in your life, okay. So self-harm is another issue, and that was not a thing that, at least in my opinion, existed when I was young. I don't know, I'm sure it did, but it didn't, thank you.
It wasn't talked about, but it did.
Yeah.
Allergies didn't exist. Nobody had I don't know about that, but so what is self-harm, and does depression lead to it, or does self-harm lead to depression? How does that work? What's the...
When people talk about self-harm, it's most commonly talked about in the context of depression, but there's a lot of other things. So to backtrack, self-harm is essentially exactly what it sounds like. It's somebody doing something intentional to hurt themselves. Most commonly, people hear self-harm and they think cutting, but it can also be as benign as picking scabs, not allowing them to heal. It can be as severe as intentionally breaking bones. So there's all sorts of things that people do to self-harm. The one thing about self-harm is that it's not in and of itself a mental health disorder. It's not a diagnosis. It is a symptom. It is showing that there is a significant amount of emotional distress, and it's a maladaptive coping skill. So people are trying to make themselves feel better, and this is
What is a maladaptive?
maladaptive coping skill means it is something somebody is doing in order to try to help themselves feel better. It's not good for them.
But it's a negative
essentially.
thing.
It's not a good thing. It's
So
actually
it wouldn't be like eating vegetables.
eating vegetables, not maladaptive.
Gotcha.
Very adaptive, actually.
Something harmful to yourself.
Yes. So there are other disorders that self-harm is a big component of. Depression is one of them. It doesn't mean that everybody who has depression will self-harm, but that is one of the criteria that is involved in diagnosing is whether or not that's there. But also people with things called borderline personality disorder, bipolar disorder, eating disorders, post-traumatic stress disorder, all of these kinds of things can lead to self-harm.
Do you think does an eating disorder, is that in the same category as a self-harm thing, where like if someone were cutting themselves or whatever, is an eating disorder along the same?
It can be. The intention behind an eating disorder can certainly be like a,
To hurt
self-harm to
yourself?
hurt myself. But for the most part, it's more about body dysmorphia and things like that. So it's more about just how you see yourself and wanting to attain a certain image.
This question came in from Facebook. It was, what is the likelihood that a woman with pre-existing mental health issues could develop postpartum depression?
So
First of all,
yes.
explain postpartum depression.
Postpartum depression is essentially a depressive episode that occurs after having a child. So you meet all the criteria of a depressive episode, but then there's this component of, you just had a baby. And so there's lots of things that influence whether or not somebody may develop postpartum depression. A history of mental illness or depression can increase the likelihood. It is a risk factor for developing postpartum depression, but with any risk factor, it's not like that having this will be that, right? So it's hard to say, it's hard to give total assurance, like no, you'll be fine, or yes, you need to kind of be wary, but.
I think postpartum depression, from what I understand, affects many more women than women have let on. That it's far more pervasive than people think it is. And I've heard people talk about that. So it being something that's embarrassing for them.
Mm-hmm.
They're embarrassed to admit that they have postpartum depression.
Sure.
Why is that?
So there's, I think that the reason why not most, but a lot of women don't actually end up getting a diagnosis or treatment for postpartum depression is twofold. So there is a period of time after having a baby where you are just super, super, super emotional. Your body is going through a lot of changes and you're losing a lot of blood. Just chemically, you're kind of imbalanced anyway. Those are baby blues. Those people cry a lot, women cry a lot. So that is very different. Postpartum depression lasts longer than baby blues, and I think that it's not necessarily recognized, if it's a very classic, oh my gosh, I'm crying a lot, I feel so sad, I don't feel bonded with my child, that is very easy to identify as postpartum depression. A lot of times postpartum depression comes out in irritability and anger, and that doesn't necessarily seem so cut and dry, okay, this is postpartum depression. I think there's also some shame too, which there shouldn't be, but there is, in this idea that I just gave birth to this child and I should be completely bonded and in love and everything should be perfect. I have this wonderful blessing. And when women don't feel that, it's very, very hard to admit that.
Sure. Yeah, I can see that. A wonderful blessing that is also crapping all over you, throwing up things.
Sure.
And I can imagine a woman not being super stoked about that all the time. I'll tell a story. One time, not long after Shannon had given birth to one of our kids, my morning breath made her throw up. So
I was still pregnant.
that was, oh, you were pregnant at that point? All right. She had prepartum puking. So about prescribing medicine for depression and other mental illness, what's your thoughts about, when is it warranted and how long should somebody take it? Is it too long? Is there a period of time where you go, okay, time to deal with this in another way?
Yeah. So I'm going to throw out a caveat that I do not prescribe medications. I cannot prescribe medications. That is solely the work of somebody with a medical license, which I do not have. So I absolutely end up having people come see me that I then refer on to see a psychiatrist and nurse practitioner in order to get prescribed medications. There are times where the best course of treatment is a combination of therapy and medication, particularly when there's chemical imbalances going on, and that's not something we can just look at somebody and say, oh yeah, okay, this is depression caused by the lack of serotonin in your brain, so you need to go get that fixed. What I tend to see is when there's no progress being made in therapy, when it's very difficult for this person to utilize strategies and get any benefit out of therapy, then there may be something more that they need. And so that boost of medication helps therapy to be beneficial then. There's also this idea of, can a person take it for too long? There are people who do actually need, particularly depression medication for a long period of time. The likelihood that you'll be on depression medication increases more with each depressive episode you have. So depression is episodic, meaning you can have just one episode of depression and never be depressed again. But somebody who has repeated episodes, so depression keeps coming back and back and back and back, that tends to signify, okay, there's something chemical going on and medication is warranted.
Okay. Proverbs 15:25 says, a person finds joy in giving an apt reply, and how good is a timely word. I know that words can be good, words can be abused. What are some things that you should avoid saying to someone dealing with depression? Like just flat out, never say it, fight the urge, grab your tongue.
Any version of, just get over it, or everything's going to be okay. I think those things really, tend to come from a well-meaning place. This idea of like, oh, there's a light at the end of the tunnel, or those kinds of things. Like you're not really hearing the person where they're at,
Right.
and that tends to shut them off more than it engages them. And it sometimes makes them feel worse about having depression. Like, okay, well, I feel bad and I'm not being hopeful about my feeling better, so then they feel worse. So anything that's kind of like, platitude, I guess, is not super helpful.
Okay. Platitude, that's a great word. You're so smart. I want to talk about anxiety really quick, and we're going to have to skip some of this stuff, but what I can do, if you want, is make Melissa's notes available, because we are going to have to move along with some of these things that I really want to get to. But concerning anxiety, what's the difference between an anxiety attack and a panic attack?
So an anxiety attack tends to build, a panic attack is immediate. So an anxiety attack is like a build up of, there's something that you're concerned about, something that you're feeling some worry about, it builds up, and then you have this big amount of it.
Where's Anthony?
Oh, good.
Oh, he left? That's our resident fireman.
Oh, okay.
I was
All right.
Jerk.
So an anxiety attack builds up, and it gives some physical symptoms. A panic attack is like an immediate, fear-based, heart is pounding, losing breath, and is a part of something that you're fearing. So.
Okay. A really quick answer for this, if you have one. Why does someone with anxiety often make plans and then cancel them?
People with anxiety very much want to be connected, and they want that relationship, and they want to be around people, but the anxiety tends to win. So they cancel because it's just very difficult for them to be able to.
What would you suggest they do? Like because if I want to go do something, I'm going to stand up and go do it. Like this happens every night in my house. I say, I'm going to bed, and then I stand up and I walk to the bed every single night. You know what I mean? I don't help with anything. I'm a terrible husband. So what's to stop them? What's to stop someone from with anxiety from, how do they do that? How do they, if they want it, how do they get it?
it's really about challenging what is going on for them. So I tend to think somebody who has anxiety who wants to go and do something, they start then thinking, well, this place tends to be crowded and I don't like to be in a lot of, like, around a lot of people, and what if, you know, this person thinks this, or this, so the thoughts start to build up, which then create physical symptoms of anxiety, and then it's easier to just avoid it than it is to actually participate.
So is that the beginning of the fight or flight reflex?
Yes, it very much can be. You know, what I tend to work on when people have anxiety and are avoiding things, so canceling plans, is building themselves up to actually face it, because the more we avoid something, the more anxiety provoking it becomes for us.
Avoiding it gives it fuel and power.
Yes.
Yeah.
Absolutely.
Okay. I want to skip a couple of these. Does anxiety affect more women than men?
Yeah, more women tend to have anxiety than men. It's like between puberty to the age 50, women are 5 times more likely to develop anxiety.
5 times.
5 times.
Wow. I did not know that. That's crazy. There's a passage in Philippians chapter 4. And I'll have the slides up for this. It says, do not be anxious about anything, but in every situation, by prayer and petition with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. Finally, brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, what? Think about such things. Whatever you have learned or received or heard from me or seen in me, put into practice, and the God of peace will be with you. How does how does what we think about and what we do affect our mental illness if we're struggling specifically with anxiety or depression?
So we have no control over the immediate thoughts that we have, but we have control over what we do with those thoughts, and we have control.
What we linger on.
Right,
Yeah.
exactly. So by having an anxious thought and either, you know, putting a lot of power into that, or saying, I'm not going to think about that, I'm not going to think about that, it then creates even more anxiety to happen. It's a vicious cycle. So, you know, we have some power over what we put into practice, over what we do in order to help these symptoms at least not become so large.
So speaking of that power, we talked about techniques to deal with stuff, like breathing techniques specifically.
Yes.
You said you would teach us a breathing technique to deal with anxiety.
I can.
you do that now?
Yes.
All right.
Okay. So I don't need a volunteer for this.
Okay, that's
if
fine.
Okay.
Yeah, just, I thought it would be funny, but no.
Okay. If somebody wants to come up and volunteer, by all means.
You can just do it there.
That's fine. So I'm actually going to have all of you do this. So that's kind of where the volunteer comes from.
A lot
So
of volunteers.
one hand goes on your stomach, one hand goes on your chest. And the purpose of deep breathing is to, if you slow down your breathing, you slow down like how fast your blood is pumping, you slow down your heart rate, it makes kind of everything slow down, which then makes the anxiety slow down as well. So the purpose of this is to breathe as slowly as possible, but also to breathe into your stomach so that your hand is being pushed out as you're breathing. So take a deep breath on the count of 3. 1, 2, 3, breathe in. Make sure your hand is being pushed out, hold it, and then breathe out slowly. 3, 2, 1. When I have people do this, I have them repeat it a few times, so 3 more times of that. And see if it feels like things are kind of slowing down for you.
I see some people with their eyes closed. Do you recommend that?
If it makes you more comfortable, absolutely.
Okay. Don't do that while driving.
No, no.
Wow, I felt better after one conscious deep breath in.
Yeah, we don't really focus as much on our breathing as we should, but it's
That's
kind
what
of
Apple
a
Watch tried to do.
cleansing, yes, cleansing deep breaths help kind of slow everything down, which is helpful.
All right, 2 more questions. Number 10, can someone be therapy resistant? Is someone so damaged that therapy and counseling won't work?
I don't believe that. I think that
Preach.
there are times that, again, there may be biological factors that need some additional support. So medication to help therapy be beneficial, but I think saying I'm too damaged for therapy is akin to saying I'm too damaged for God's love. So I fully do not believe that there is such a thing as somebody who is beyond help.
I think, thank you for that. I had the thought that somebody would be therapy stubborn, that they don't want to. Do some people just like to sit in their filth and, like, you think about that idea of therapy resistant, therapy stubborn, or whatever, because it's hard. Like,
It is.
getting well is hard.
Yes.
It takes work. When Jesus healed people, he said, "Do you want to get well?"
Right.
Because there's something on the other side of that. For Jesus, he was miraculous, so it was like, poof, and you're done.
Mm-hmm.
But for us, to heal and to get better, it's a long, hard process. And so, do you think that there are people who just, they're just more they're more comfortable where they are, than they don't want to do the work? And not.
So yeah, I think that people don't enjoy living with mental illness. It is not something that they like. There are people who have a very, very difficult time changing because for any of us, any change is scary.
Right.
And it is sometimes so much easier to live with what you know than it is to make a change because you don't know what that other side is going to look like. At least when you have depression, you're like, okay, well, I know that this day I'm going to feel sad and I'm going to, probably sleep a little bit more. Today's a bad day for me. I know kind of how to handle it. But when you're making changes, it's scary. And so sometimes it's very difficult to start making those changes.
I feel like we need more time for this, but we are unfortunately out. So I'm going to invite the band to come back up. And just one last question for Melissa. How do I know I need help? How do I get started? Do I need therapy? Do I need psychiatry? Do I need an extra something? How do you know? How do you know what to do? Where do you go?
I think if you're asking the question, then it's definitely worth kind of talking to somebody. There are a ton of agencies around. Psychology Today is a wonderful resource to just kind of give you a list of therapists that are in the area. Basically, if you are struggling with something, depression only takes 2 weeks to be diagnosed. Like that's as long as those symptoms need to be present to be diagnosed. So if you're feeling something that's not changing, it's not getting better, things that you're trying aren't working, it's time to kind of see somebody to get some additional support. I say always start with therapy, and then a good therapist will help you recognize whether or not you need something like a psychiatrist or a nurse practitioner to kind of go down the medication route. So
Awesome. Thank you, Melissa. Can you guys say thanks? Let's pray for her. We'll just stand and let's pray for Melissa and her practice and for everybody struggling through this stuff. Jesus, we thank you for your love. We thank you that I know you encountered people in your time on earth that were dealing with mental illness and struggle and pain and depression. And I love the example that you left for us of just holding someone and loving them and working with them, bringing them through the mess and stuff that they were in. I thank you that there are people like Melissa and her husband who serve in therapy and counseling situations, people who have given their life to you and are ready to help others conquer the things that are going on inside of them. So God, I pray for everybody in this church that is dealing with that, people who know folks who are dealing with mental illness, that we would not just sit quietly or alone, but we would do the things that are necessary to work through the issues that we have. You are the God of the other side, and don't let Satan tell us the lie that there's no other side to our stuff. Thank you, Jesus, for always being there, for never leaving us or forsaking us, even in our junk. In your name we pray. Amen.